The internet is playing a critical role in how people make up their minds on a variety of topics. And this is not just about social media, it's not about Facebook and Twitter, it's really about how we use the web, how we go to Google to inform ourselves on something, and how we read a piece of information and suddenly that helps to shift our opinions on a specific topic. Then we might share that through social networks with friends and family. So it's playing an increasingly critical role. In fact, I think it's playing the critical role, and that's why a lot of the negative information we see has spread so effectively. So what we need to look at is what the institutions, the industry, the public health officials need to do. And my essential recommendation is they need to acknowledge this change, and they need to adapt their mindset in order to start understanding that they need to learn about how to use these tools. They need to experiment with new approaches, and by that experimentation they can start engaging with the people that are looking for information. They can start creating credible, useful, interesting information and be part of the story, because for the moment, although they're part of the story in a small way, a lot of the noise we have is very confusing, very distracting, very complex to understand. So they need to engage and embrace these tools, because they're going to be the hub and the core of what they do in the future. When you currently look on Google, you see a lot of confusing information, and there's still a disproportionate amount of information that's kind of being pushed out without any real scientific backing. Now, in order to change that trend, I don't think it's about populating the internet with a lot of positive stories about vaccines. I think it's about the right people engaging with their networks, with their intimate networks of patients, of colleagues, of friends, and really helping people who then know those networks to find their way around it, to be able to navigate. And then gradually from that, you'll have a more balanced view of things. So I don't think it's that we kind of need a massive effort to flood the internet with information. I think we just need to really focus on the quality of information. How can you as a patient find a site that helps you to answer the questions that you have? And how can doctors get the information, the backing, if you want, of some of the information they'd like to give their patients, but it's a bit too scientific, it's a bit too complex. So where can they go to facilitate that process? And when people have legitimate questions, they need to answer them, whether it's doctors, experts, or institutions, but there needs to be a genuine dialogue. So that's where I would put the focus.